Aggression is pretty common in dogs in the United States. One study estimates it to be about 50% of dogs show aggression. Now, one type of aggression that really seems to upset pet parents is when it appears unpredictable or when it appears intermittent. Like the same thing can happen again and again, and the dog is sometimes aggressive in that situation and sometimes not. When that happens, I go down a specific path, and that is the path of pain or discomfort, right? So think of behavior as the sum of all things, okay? It's how you feel, it's your environment, it's what you're eating that day, it's whether or not you have pain or discomfort, it's what happened to you that day. So it's kind of everything combined. On the days when the dog is uncomfortable, or a cat for that matter, then the threshold to show aggression goes down, right? It kind of all piles up and the fuse gets really short. Say, for example, you have a dog who plays in the yard and goes for a walk with you and has a pretty good day, but he's got undiagnosed arthritis. So sometimes when he overdoes it and he's lying on the bed at night and you approach him to pet him, he growls at you. But other days when you've been at work all day and he didn't have a big day, he wouldn't growl at you when you went to pet him. That's because on the days when he growls, the sum of all things has caused his fuse to be very, very short. It also happens with gastrointestinal disease. Let's say your dog eats breakfast and then they start to feel a little crampy. They go outside to the bathroom and come back in. You're getting ready for work. You give your dog a kiss on his head like you always do, and he growls at you. And you think, what? How is today different? It's different because internally it's different to the dog. We cannot see how dogs are feeling no matter how much you think you can. You just don't know. So if your dog has waxing and waning or intermittent aggression with the same trigger again and again being presented, but your dog isn't always aggressive during that time, go to your vet and ask for a full baseline blood work, a pain check, and a physical exam, or just reach out to a board certified veterinary behaviorist and get your dog checked out.